Hello, my name is Suzanne Theresa Walter, and I will be talking about pediatrics endocrinology. Moving on. First off, I would give a brief introduction about the specialty that I've chosen. So, a pediatric endocrinologist is a healthcare provider who specializes in children's endocrinology, a field of medicine that studies conditions related to a child's hormones, and they are responsible in diagnosing and treating endocrine conditions in children and adolescents. And they may also treat issues related to puberty, growth, diabetes, or other disorders related to hormones and glands that produce them. Next. So this is a visual representation of the endocrine system. As you can see, there are various organs related to the endocrine system, and the major role of the endocrine system is to regulate the production and release of various hormones. And some of the process that is closely related to the endocrine system is the metabolism process, reproduction, growth and development, and also the homeostasis of the internal environment in our body. But for the sake of our discussion today, I will only be focusing on one of the organ, which is the thyroid gland. So now I will be going deeper into the anatomy of the thyroid gland. As you can see, I have provided two visual representation of the thyroid gland. On the left side is a visual representation of the thyroid gland in a cadaver, whilst on the right hand side of the slide is a visual representation of the thyroid gland with color coding. So the anatomical location of the thyroid gland is on the anterior neck, and it spans throughout the C5 and T1 of the vertebrae, and it has two lobes on the left and right side, and the lobes are connected by a central isthmus, and the lobes are wrapped around a cercoid cartilage and superior rings of the trachea. The gland is located within the visceral neck compartment, and the compartment is bound by pretracheal fascia, as you can see on the right hand side of the slide. The color coding helps us to see the components easier. So moving on. Now I will be talking about the mechanism of the thyroid hormone synthesis. So the thyroid hormone synthesis, in summary, there are 6 process related to the synthesis of thyroid hormone. And to remember it easier, we use the mnemonic ATEICE, which is 8 I's. A stands for active transport, T for thyroglobulin, E for exocytosis, I for iodination, C for coupling reaction, and E for endocytosis. And on the right hand side of the slide, you can see the overview of the synthesis of thyroid hormone. Moving on. So now I will be explaining deeper on each of the process so that we can understand thoroughly the thyroid hormone synthesis. So first off is A, which is active transport of iodide into the follicular cell via the sodium iodide symporter, which is the NIS. This is actually secondary active transport, and the sodium gradient driving it is maintained by sodium-potassium ATPase. And next is T, which is thyroglobulin, also known as, in short, it is called TG, which is a large protein rich in tyrosine, and it is formed in follicular ribosomes and placed into secretory vesicles. So the third process is E, which stands for exocytosis of thyroglobulin into the follicle lumen, where it is stored as colloid. Thyroglobulin is the scaffold upon which thyroid hormone is synthesized. The next process, which is iodination of the thyroglobulin. Iodide is made reactive by the enzyme thyroid peroxidase. Iodide binds to the benzene ring on tyrosine residues of thyroglobulin, forming monoiodotyrosine, MIT, then diiodotyrosine, which is DIT. The next process is coupling of MIT and DIT, which gives rise to triiodothyronine, which is T3 hormone, and coupling of DIT and another DIT gives the tetraiodothyronine T4 hormone, also known as thyroxine. And last but not least, the process of endocytosis of iodinated thyroglobulin back into the follicular cell. These thyroglobulin undergoes proteolysis in lysosomes to cleave the iodinated tyrosine residues from the larger protein. Then the free T3 or T4 is then released and the thyroglobulin scaffold is recycled. As you can see, I have provided key abbreviations to make the explanation simpler, and I have also provided a picture of the whole process in summary. So next off, I will be talking about the related disease which involves the thyroid gland. So as you can see, the most common condition related to the thyroid gland is hypothyroidism and hyperthyroidism. So the difference between these two is that in hypothyroidism, the thyroid hormone is produced in excess by the thyroid gland, while in hypothyroidism, the production of thyroid hormone is lower. And in hyperthyroidism, one of the risk factors is Graves' disease, and some of the signs and symptoms that can occur is a high production of thyroid hormone, high heart rate and blood pressure, and also high temperature. Whilst in hypothyroidism, one of the risk factors that can arise from this condition is Hashimoto's disease, and some of the signs and symptoms that are related to this condition is low production of thyroid hormones and a low heart rate, which is bradycardia, and low blood pressure and low temperature. Moving on. So now I will be talking about one of the condition, which is hyperthyroidism, which arises from an overactive thyroid. To be specific, I will be talking about Graves' disease. As you can see from the pictures I've provided, there are various symptoms of Graves' disease. For example, rapid heartbeat, also known as palpitations, and an increased appetite but a loss in weight. And they also have frequent bowel movements. And there are also prominent symptoms, for example, bulging or irritation of the eye, goiter, and also skin rashes. Next up, I will be talking about treatments that are available to manage these symptoms of hypothyroidism. So first off, there are beta blockers, which is usually the first line of defense. They are used to regulate the heart rate and protect the heart because, as we know, a person with hypothyroidism have rapid heartbeat, which in the long term can eventually damage the heart. Second is antithyroid medications. These medications are used to block thyroid hormone production, and some of the more common ones are methimazole and propylthiouracil. And last but not least, doctors would also prescribe radioiodine therapy, which involves taking one dose of radioactive iodine, whether in pill or liquid form, over the course of 2 to 3 months. And these radiation will slowly destroy thyroid gland cells and in turn will reduce the production of thyroid hormones. So now I will be talking about a known Malaysian specialist that specializes in pediatrics endocrinology. So the specialist that I've chosen is Dr. Cheng Tong Wui. So her educational background includes getting her medicine degree at Dalhousie University, Canada in 2005. She is also involved in the Pediatrics Endocrinology Fellowship at SUNY Downstate Medical Center, and she's also involved in pediatrics residency at the University of Minnesota And it is worth noting that she is a recipient of various awards, for instance, Early Career Forum Award in conjunction with ENDO 2017, and also poster presentation in conjunction to the Annual Research Day 2018, of SUNY Downstate Medical Center. And she is now working as a pediatric specialist at Sunway Medical Center, Kuala Lumpur. And I believe that is all from me. Thank you for watching.